Good afternoon. Thank you so much for coming to the Health and Government Operations Committee. This is our voting session. Our chairman is excused today, so I will be conducting the proceeding. There are actually no withdrawals today on the voting list. I want to take a minute to welcome Susana Rodriguez Alfaro, who's actually going to be working with the HGO Committee. She's right there for the remainder of session to help the chair and Richard and everyone else. So welcome, Susana, to the best committee in this house, okay?
Yeah.
So absolutely. So we're going to start with House Bill 213. The sponsor is Delegate Kelly, Health Information Exchanges, Definition and Privacy Regulations. Erin?
This bill alters the definition of health information exchange for purposes of the confidentiality of medical records. In adopting regulations for the use of health information for specified purposes, the Healthcare Commission may not prohibit the sharing or disclosing of information required to be exchanged under federal or state law, the use of electronic health information for health regulatory or public health functions by MDH, MHCC, or the HSCRC. There are amendments on page 3 that clarify that the definition of health information exchange includes a health information technology developer, and also authorize the Healthcare Commission to adopt regulations that are more stringent than federal law.
Thank you, Erin. So we discussed this bill in the Public Health Committee. The Executive Director, Ben Steffen, wrote a letter saying that the change in definition of an HIE proposed in House Bill 213 will ensure that all entities that are currently providing the functions provided by an HIE are held to the same standards regarding privacy and security. This is a cleanup bill from a bill that we did last year. So are there any questions? Seeing none, may I have a motion?
Move the amendments.
May I have a second?
Second.
It's been moved in second. Any discussion? Seeing none on the bill as amended, may I have a motion?
You want to
Move
vote
the
on the
bill.
amendments?
Second.
It's been moved in second. Any questions? All those in favor say aye.
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 Any
Aye.
opposed? Seeing none, the bill passes unanimous. Thank you very much. The next bill is House Bill 218, Delegate Kelly, Health Occupations, Nursing, Dialysis, and Technician. Lindsay.
This bill repeals the requirement that a dialysis technician be a certified nursing assistant and instead establishes a separate certification for a certified dialysis technician under the State Board of Nursing. The board must adopt regulations for establishing qualifications for certified dialysis technicians, maintain a list of all certified dialysis technicians, set applicable fees, and initiate disciplinary action. There are amendments that begin on page 8 of your packet that were adopted in the Health Occupations Subcommittee that require an individual to be certified by the board, both to practice as a certified nursing assistant and as a dialysis technician before the person may practice as a dialysis technician in a state-owned hospital or state-owned facility. Removes obsolete language relating to criminal history records checks for medication technicians, and alters language relating to training requirements for certificate renewal.
Delegate Kelly. Thank you, Lindsay.
Thank you, Madam Chairman. This bill was discussed in Health Occupations, not this week, but the previous week. When we discussed it, we adopted the amendments from the Board of Nursing and the amendment from AFSCME that applies to our state hospitals, because the folks who are getting that hospital level care do need someone who also has the CNA certification. So those amendments passed unanimously and the bill passed unanimously. I did have a conversation with Karen Evans with the Board of Nursing to make sure that that the bill with these amendments has a lesser fiscal impact. The fiscal note says it's $282,000, but that was assuming that the IT costs would be $150,000. Actually, it's about $25,000, according to Karen Evans. And in addition, the fiscal note calls for some staffing that actually is not necessary. I think the numbers in the fiscal note were inaccurate in terms of they looked at 3,000 to 5,000 applicants. That's actually over a 5-year period, not a 1-year period. So the fiscal impact is going to be significantly less than the fiscal note calls for. And with that, I move the amendments.
Second.
Is there a second?
Second.
It's been moved in second. Are there any questions? Seeing none on the bill as amended, may I have a motion?
Move the bill as amended.
Second.
Second.
Is it moved in second? Any discussion on the bill as amended? Seeing none, all those in favor say aye. Any opposed? Seeing none, the bill passes unanimous. We have next House Bill 219, Delegate Kelly, dental hygienist consultation requirements, healthcare practitioners. Lindsay.
This bill authorizes a dental hygienist to consult with a patient's registered nurse practitioner, certified nurse midwife, or licensed certified midwife before proceeding with treatment if there's a change in or concerns about a patient's, in the bill as originally introduced, in patient's medical history. The bill authorizes a dental hygienist to practice under the general supervision of a licensed dentist in clinical offices of physicians, registered nurse practitioners, certified nurse midwives, or licensed certified midwives. There are amendments that begin on page 30 of your packet, adopted in Health Occupation Subcommittee, that clarify that in public facilities, a dental hygienist should consult with the supervising dentist or a patient's dentist and the physician, nurse practitioner, certified nurse midwife, or licensed certified midwife, and requires the consultation if there is a change in a patient's medical condition rather than a change in medical history. In long-term care facilities and clinical offices, the consult is with a supervising dentist and treating physician, registered nurse practitioner, certified nurse midwife, or licensed certified midwife. And again, a change in medical condition.
Thank you, Lindsay. Delegate Kelly.
Madam Chairman, the amendment that was just described from Lindsay was the amendment, a modification of the amendment that was discussed in the bill hearing brought to us by the dentists. Again, this legislation is just adding a couple of practitioner groups to the already established program that Delegate Kipke's bill established a few years ago. And the hygienists and the proponents of the bill and the dentists are all supportive of the amendment, and the amendment passed unanimously, as did the bill. Move the amendment.
May I have a second? It's been moved in second. Any questions on the amendments? Seeing none on the bill as amended, may I have a motion?
The
Bill is amended.
Perfect,
May I have a
second.
second? It's been moved in second. Any discussion on the bill as amended? Seeing none, all those in favor say aye.
Aye.
Any opposition? The bill passes unanimous. Thank you so much. Next, we have House Bill 237, and that bill is Delegate Palakovich-Carr, State Government Maryland Veterans Commission membership. Lindsay.
This bill expands the membership of the Maryland Veterans Commission by adding a representative of the Reserve Organization of America as a voting member. There are no amendments. It was considered in Government Operations Subcommittee.
Delegate Rosenberg.
Thank you, Madam Chair. This
My
was
pleasure.
unanimous in the subcommittee and would move favorable.
Is there a second?
Second.
Is there any discussion or concerns? Seeing none, all those in favor say aye.
Aye.
Any opposed? Seeing none, the bill passes, is unanimous. Next, we have House Bill 245, Delegate Resnick, Program for Preventing HIV Infection for Rape Victims, Alterations, and Repeal of Sunset. Erin.
This bill repeals the termination date of September 30th, 2022 for the pilot program for preventing HIV infection for rape victims and establishes the program as permanent. The bill also repeals the annual limit of $750,000 that may be paid to physicians, qualified healthcare providers, and hospitals from the Criminal Injuries Compensation Board.
And there are no amendments in the bill, correct?
Correct, no amendments.
Okay, the bill passed in subcommittee unanimous. I actually move the bill.
Second.
Okay, any questions or concerns? Seeing none, all those in favor say aye.
Aye.
Any opposed? None. The bill passes unanimous. Members, this bill is jointly assigned with judiciary. So you will not see it in the calendar until judiciary votes on it because they're secondary, okay? Thank you so much.
Madam Chair.
Next, we have House
Madam
Bill
Chair.
247, Delegate Resnick, Insurance Medicare Supplement Policy Plans, Open Enrollment Period following birthday.
Madam
Lisa.
Chair,
Hey,
Delegate
Madam Chair.
Morgan is.
Oh, I'm sorry, Delegate Morgan, didn't see you.
Well, I didn't know if we had a chance to co-sponsor that last bill. because it was jointly signed. I didn't know if there's any amendments on it.
We can actually do that one. I think we can, Aaron, right? Just that one.
So usually you don't, if it's hasn't been amended, but
If we can't, don't worry about
Morgan's
it.
point, since it's jointly assigned, you could go on and then.
Okay, well, thank you for making
would
the
like- if you would
exception.
like
I
to
know
have
it's a lot of work, but we'll do it. So who does not want to be on the bill as a co-sponsor? If you do not want to be on the bill as a co-sponsor, will you please raise your hand?
Which bill are you talking about?
We're talking about House Bill 245, the HIB program. Okay, everyone wants to be on it, Aaron. Thank you so
Okay.
much. Thank you, Delegate Morgan. We have next the House Bill 247, and that's the Delegate Resnick, Insurance Medicare Supplement Policy Plans, Open Enrollment Period following a birthday. Lisa.
This bill requires a carrier that sells Medicare supplement policies to provide an enrolled individual the opportunity to switch to a different Medicare supplement policy with equal or lesser benefits within 30 days following the individual's birthday. Carrier is prohibited from denying or conditioning a new policy, discriminating in the pricing of the policy, or denying, reducing, or conditioning coverage because of health status, claims experience, receipt of healthcare, or medical condition of the individual. A carrier must notify an insured of their right to switch plans at least 30 days, but no more than 60 days before the insured's birthday. There are amendments on page 33 of the packet sent around by Richard. Amendment 1 is technical. Amendment number 2 removes the word plan when referring to Medicare supplement policies. Amendment number 3 makes provisions regarding pre-existing conditions that currently apply to the initial enrollment period for Medicare supplement policies also apply to the special enrollment period for birthdays, and provides that the special enrollment period for birthdays applies to individuals enrolled in Medicare supplement policies who have birthdays on or after July 1st, 2023. Amendment number 4 specifies the manner in which Medicare supplement policies are compared to determine whether they have equal or lesser benefits, and requires the insurance commissioner to establish a matrix for identifying which Medicare supplement policies have equal or lesser benefits. And amendment number 5 changes the effective date.
Delegate Collison. Thank you, Lisa.
Thank you, Madam Chair. Thank you, Lisa, for that thorough explanation. Fellow committee members, this is the third time this bill has been before us. Initially, the carriers were concerned about this causing increases in premiums because of the way people would select plans. The MIA studied what states who are currently doing it, the impact has been, and did some modeling to see what they believed would happen in terms of how they might affect premiums, and reported to us this year that they did not think it was going to have the effect that the carriers were concerned about. So in working with the carriers on the bill this year, we determined that there were some they needed some time to build their technology in order to do what we're asking them to do. So this bill is the product of that study and negotiation. And the amendments are the result of the MIA making sure that the bill and the process aligns with the current initial MedSup enrollment process. So with that, I move the amendments.
Second.
It's been moved in second. Excellent work, Delegate Collison. Any discussion on the amendments? All right. On the bill as amended. All
Move the
those
bill
in
as
favor?
amended.
Second.
Wonderful. It's been moved in second as amended. Any questions? All those in favor say aye.
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 Any opposed? And am I right to say that you want to be on this bill?
You got it.
Okay. So the question is there someone that does not want to be on the bill?
Can we
All
do
right.
it? Can we
All
do
of
it
us want to be on the bill. Delegate Collison?
Yes, I just was wondering, can we do sponsor amendments when there are amendments? Is that?
Yeah,
okay?
that's the
Yes.
best way to do it.
Okay, great. Just checking. Yes, I want to
Because
be on
then you're
this bill.
already reading them and then you say,
Yeah.
oh, and there's a sponsor amendment.
Oh, okay. Got it.
Thank you, Lisa. Thank you, Delegate Collison, for your work. We have House Bill 279 next. And it's Delegate Rogers, Veterans Affairs Office of Communications and Public Affairs, Veterans Advocacy and Education Act. And that is Lindsay.
As originally introduced, the bill renames the Outreach and Advocacy Program in the Maryland Department of Veterans Affairs to be the Office of Communications and Public Affairs. The office, in collaboration with the Maryland Higher Education Commission, must actively help veterans and their dependents become aware of and access education and training benefits to which they are entitled. The bill alters and expands the responsibilities of the Department of Veterans Affairs and the office as they relate to veteran services, including the contents of the department's annual report. There are amendments in page 36 of your packet that were adopted by the Government Operations Subcommittee that rename the Outreach and Advocacy Program instead of the office to be the Communications Outreach and Advocacy Program, and retains the requirement that the director of the program implement an outreach plan.
Thank you so much, Lindsay. Delegate Rosenberg.
Thank you, Madam Chair.
My pleasure.
There was discussion in the subcommittee to make certain that all programs and benefits of the Veterans Administration that would be treated the same, that this was not benefiting some to the exclusion of others. And when we were reassured of that, the vote was unanimous. So I would move the amendments.
Wonderful,
Second.
thank you. It's been moved in second. Any questions or concerns? Seeing none, the bill as amended. Delegate Rosenberg, you want to move it?
I so move.
Second.
As amended.
It's been moved in second as amended. Any discussion or concerns?
Madam
Seeing
Chairman,
none, excuse me, Delegate
So-
said,
to be added on as sponsors.
yeah, we're gonna, let me just take the vote and we'll do that. Thank you so much. for the suggestion.
You're already on it.
Oh, better.
Okay, okay, all those in favor of the bill as amended?
Aye.
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 Okay, any opposition? None. So, who wants to be on the bill?
Who
Who
doesn't?
does not want to be on the bill? Everyone wants to be on the bill.
I want to move to remove Delegate Saab from the bill.
Not accepted. How's that? Okay, we have House Bill 286, Delegate Kaiser, Emergency Medical Services, Paramedics Immunization Administration effective date, and that is Aaron.
This bill retains for 3 additional years until January 1st, 2026, the provisions of law that authorize a paramedic to administer influenza and COVID-19 immunizations as part of a population health outreach effort conducted by the appropriate local health department or a hospital or health system in the state. And
I
there,
have an amendment on the bill, and it's basically to reduce it from 3 years to 2 years. So we discussed this bill in committee. The vote, there were 2 people in opposition. The rest of it were in support. And there, before I move the amendment, Delegate Shalega has a question. Delegate Shalega.
I'll wait till you move the amendment.
Okay, thank you. Will someone move the amendment?
Move the amendment.
Can I have a second, please?
Second.
It's been moved in second, and now any discussion, Delegate Shalega?
Sorry, I jumped the gun on that.
It's okay, thank you.
So I was one of the 2 people that voted against this, and it wasn't for the reason that I have an additional concern about. And I'm so glad that Dr. Terry Hill is on this call, because a constituent called me about an issue that I wasn't aware of. It's something called SERVA, which is a shoulder injury related to vaccine administration and other injection site events. And there's a study by the official publication of the College of Family Physicians of Canada, but we still, I'm sure, listen to some of their research. But anyway, it talks about injuries from the vaccine administration, and what conclusion of this is the key to preventing SERVA and other vaccine injuries is landmarking and making sure Even the most experienced healthcare professionals can develop bad habits and need to polish their skills periodically. So nevertheless, there's that. And then there's another thing called the vasovagal.
Vasovagal.
Thank you.
Vasovagal.
Syncope. And that, is different than actually injuries from the administration of the vaccine. And it actually used to be part of the there's a national vaccine compensation fund, and they used to have CERVA in that, but I think the injuries have increased and so they took them out of it, but there's a whole papers and whatnot. So would love to hear Dr. Hill's opinion on allowing EMTs. I mean, obviously during COVID, we needed all hands on deck, but as a public health policy, I'm not sure we should be expanding this practice.
Delegate Hill, would you like to address it?
Sure. So thank you, Delegate Shalega. So CERVA actually, you're correct. The National Vaccine Reimbursement Fund, which is sort of a no fault for people who develop complications for vaccine, they had looked at CERVA a couple of years back and were concerned that if they covered CERVA, it would bankrupt them. CERVA, as I understand, I've not read your article, was primarily seen with practically can be seen with anyone. We saw higher levels with certain kinds of non-physician, non-nurse practitioners. And it was one of the things that I looked at when we were giving permission to pharmacists. But I will note that in Maryland, number one, with the pandemic and the expansion, everybody, including physicians, and I'm sure including EMTs before being allowed to give vaccines, were trained on how to give them. And what you see with CERVA is the needle goes into the joint instead of into the muscle, and they inject into the joint, and that's how you get this sometimes very debilitating complication. So I don't think that's an issue because everyone who is being granted permission, I know it's certainly through the Medical Reserve Corps of physicians, and I'm pretty sure that the EMTs were too, are given special instructions, even though it seems like a simple thing on how to administer vaccines. So I don't think that is an issue that we need to be concerned about, but I don't have particular firsthand knowledge that training is going on, but I would expect it would. And as I said, we're allowing pharmacists to do so, and that was the group that had more of an issue. And EMTs do give shots on a regular basis.
And if I may, just for clarification purposes, the bill applies to paramedics, not EMTs.
Thank you for the clarification.
My pleasure.
And paramedics are trained in giving injections and other kinds of things on a regular basis. But my understanding would have been given additional training. They're not just given vaccines. They're told these are the vaccines. This is how it's supposed to be administered. This is how it's supposed to be drawn up and all of that kind of stuff.
Thank you. Thank you so much. Thank you, Delegate Shalega, for your question. Thank you, Delegate Hill, for addressing Delegate Riley's next.
I'm sorry, Madam Chair, she also asked about the vasovagal. So vasovagal are basically when your blood pressure drops as a result of whatever and you pass out. And if you recall, as vaccines, particularly the COVID was rolled out, one of the things that every site was doing was asking people to stay for 15 minutes to be sure that they were monitored and that they did not have a vasovagal response. And I would anticipate and expect, and certainly what we've seen in the programs that this group have been doing already, because this is not a new program, they've been doing it for the last year, that they would also be required to monitor people for a period of 15 minutes to make sure they don't have a vasovagal response. Thank you.
Thank you. And it's actually true. They actually do it with the hospitals or a clinic or the health department, and they are present and they monitor all the protocols. Thank you. Delegate Riley.
Thank you, Madam Chair. Yes, as you know, in subcommittee, I was back and forth on this. Not quite comfortable with it. I did wind up voting for it, but I just wanted to let the members know that in light of this information and seeing the article that Delegate Shalega is talking about and talking to some other folks, I will be voting no.
Okay.
Thank you.
And my pleasure. And just for the committee to know, there were 80,000 vaccines that were actually done by this group for the public, 20,000 to government employees. That's 100,000, and she reported that there were no problems. Any other questions or concerns? Seeing none. Actually, Delegate Shalega.
Thank you. I just wanted to explain my opposition in subcommittee was not this new information that someone gave me, but that I asked Dr. Google if it was hard to get a vaccine near me, and he immediately gave me an answer that there were plenty of flu shots and COVID vaccines available near me. And, hence, yes, I supported this when we did it initially, but I feel like we've adequately addressed that in public health, and that is why I am voting against it, not because I don't like and trust my paramedic friends and family members. Thank you.
Thank you, Delegate Shalega. Delegate Lewis Young.
Thank you, Madam Chair.
My pleasure.
Just want to relate a personal experience. I had a very bad reaction to my first COVID shot. I had limited range of motion in my arm for at least 3 months afterwards. My point being, and it was administered by the same people we all got our first COVID shot under the supervision of the General Assembly. So my point being, it could happen to anyone by anyone administering it. It was very uncomfortable and initially quite painful, but at the end of the day, I'd rather live with that pain than get COVID.
Thank you. Any other questions on the amendments? All those in favor say aye.
Aye.
Any opposed? Delegate Krebs, anyone else? Delegate Shalega?
No, you already passed the amendments.
Oh,
I just had a question on the bill. I'm not opposed to the
I'm
amendment.
going to move the bill. All right, on the bill as amended.
Second.
Okay. It's been moved and second. Any questions, Delegate Krebs? Then
Thank you. I
ahead,
just had a
Delegate.
question. I noticed that currently they're doing this until 2023. This bill extends it to 2026. But I mean, why are we just extending it to then? And is there any report back? I mean, are we just going to bring it back up in 2026? What's the intention?
The amendment that I have reduced it to 2 years, right? Instead of 3. And the intention is so that we don't have to come back next year. We don't know what the future holds. We're still in the middle of the pandemic. There are different variants. And this is basically, if needed, it's not that they're going out there and doing it on their own. This is done under the supervision of a hospital or the state health officer. So it's basically to have it in place just to make sure that we have what we need to make sure we protect Marylanders. As you know, we have a shortage of nurses and doctors, and we thought that this would be something that we should be doing. I know Delegate Kaiser, you wanted to speak.
Well, I'll just finish. I'm not opposed to what we're doing. I just question if it is successful, and it seems like it has been after 2 years. It'd be nice to get some type of report back to say it's successful, and let's make it permanent. I'm just suggesting
That's
that
a good
we
suggestion.
somehow follow up on it at some point. But thank you.
Thank you. And Pat is actually great to work with, so I know she would do that. Thank you for the suggestion, Delegate Krebs. Delegate Kaiser.
I'm glad to share the report from December 2021 with any member of the committee. It's available to anyone, and it demonstrates the effectiveness. And I also, in addition to that report that Delegate Krebs thinks we should have, that we do have, there's also a document that demonstrates the 19 different jurisdictions and all the sites within those jurisdictions and who was served, if you also want that information.
Delegate Kaiser, will you be so kind and give us the name of the report and where to find it?
I got it from the Maryland Institute for Emergency Medical Services Systems. I could probably scan it and have my office share it with everyone. What's
That
that?
would be wonderful.
Yeah, the
Thank
use
you.
of paramedics in public health vaccination programs. It was required under last year's law and it was done.
Thank you so much. We really appreciate it. Thank you. Great questions and discussion. On the bill as amended, all those in favor say aye.
Aye.
Any opposition? We have Delegate Morgan, Delegate Shalega, Delegate Chisholm, Delegate Riley. Thank you very much for the discussion. I really appreciate it. And we have, guess what? The final bill of the day. I know I'm standing probably between you and lunch, and that is House Bill 399, Prince George's County Delegation and Montgomery County Delegation, Washington Suburban Sanitary Commission Minority Business Enterprise Utilization Program Termination Extension. And that is Lindsay.
This bill extends from July 1st, 2022 to July 1st, 2023, the authorization of the Washington Suburban Sanitary Commission's Minority Business Enterprise Utilization Program. There are no amendments. It was considered in Government Operations Subcommittee, and we have delegation letters from both Prince George's County and Montgomery County unanimous in favor of the bill.
Thank you, Lindsay, for your work. Delegate Rosenberg.
Thank you, Madam Chair. The
pleasure.
extension is needed because the evaluation couldn't be done because of the pandemic. Unanimous in committee, move favorable.
Is there a second? It's been moved in second. Any discussion or concerns? Seeing none, all those in favor say aye.
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 Any opposed? Seeing none, it passes unanimous. Those are all the bills we have for today.
Madam
We
Chair?
have a couple of Delegate Shalega.
Oh, no, that was me. Oh.
Yeah.
No, I see the hand for Delegate Shalega.
Thank you. I just wanted to, with all due respect to my good friend and acting chair, you said that we are in the middle of a pandemic when we were talking about the paramedics using vaccines. And I'd just like to say, I think we're in an endemic now.
You're probably right.
We're not in the middle of a pandemic, so please don't say that. There's enough fear. There's enough of that. So thank you.
No.
Look, whatever you call it an endemic, I call it a pandemic because we still are in those numbers are still up, and we have about 1 million people, okay, that have tested positive in our state. And I respect your views. However, the need for the bill is that we don't know what's going to happen, whether we're going to get another variant, and we have a shortage. We have all these bills in the committee of people asking us to do things for the nurses, for the doctors, and these are other hands that are available. So
I'm sorry.
I appreciate your thoughts.
It wasn't in relation to that bill. It was just a general comment that not all medical experts agree that we're in the middle of a pandemic. Many are saying that we're moving into endemic. And so I just wanted to make that comment. Thank you.
And no, my pleasure. Everyone, that's why your 5 fingers are so different, right? We're all very different and have different views. So I respect yours. Thank you for the discussion. I appreciate it. I have Delegate Rosenberg and Delegate Hill.
I would just add, since reference, my good friend Delegate Saliga made reference to Dr. Google. His father is Professor Google, actually Professor Brin, who was recruited to College Park. He was teaching at Moscow State University. He was recruited to College Park to be in the math department. So who do you think was the head of the math department who recruited him? Britt Kerwin. And his son, Sergey, went to public schools in Prince George's County, graduated from Eleanor Roosevelt High School, then the University of Maryland College Park, and then a place called Stanford on the other coast. And you know the rest of his story. So there
we
you go.
love a historian in our committee. We're so blessed. Thank you. Delegate Hill.
Thank you, Madam Chair.
My pleasure.
I didn't realize, since we were done with voting, I had missed I think the first 2-3 bills just before Carr's bill. And I just wanted to be counted in the affirmative on those bills, the Kelly bills.
Not a problem. If
Thank
there's
you.
anyone
Wanted to do it
else that
publicly.
missed it, will you be so kind and let Richard know so that he can put you correctly how you want to vote? Are there any other concerns or questions before, and Richard is saying yes, before I give the final comments? Thank you so much for the discussion today. You know, it's a beautiful thing, different opinions, and we do it respectfully, so it's welcome. And we have on Monday, I would just like to ask the Public Health Committee that we have a meeting at 6 o'clock. And Aaron sends you the email with everything you need so that we can come ready to discuss the bills as well. And other than that, we are done. And I hope you have a blessed weekend. Please get some rest. And thank you for everything. Thank you for making this easy for me.
Thank you.